You can read the books you have at home. Keep track of all the books you read and submit the titles online at read5.org. The challenge begins on June 17th and ends on September 18th, 2020. If you read 5 or more, you meet the challenge and you get invited to my big celebration. Stay safe, stay sanitized, and read 5. Good afternoon, Virgin Islanders, at home and abroad. Yesterday, we conducted 157 tests for coronavirus in the territory. This is 5 times the average of what we've been conducting, as we only conduct about 30 tests a day. Out of that 157, 22 of those came back positive. That is a 14% positivity rate. 13 of those cases were on St. Croix, 5 of which were related to Lime Tree Bay, and 7 of those cases were on the island of St. Thomas. The other 2 identified positive cases were on the island of St. John. We are currently tracking 57 active cases of COVID-19 in the territory. Needless to say, this is not where we wanted to be at this time, but this is a stark reminder why we must remain vigilant. As of this morning, we've had tested 3,610 individuals for the coronavirus. And 3,370 of them have come back negative, 144 were positive, and 96 tests are currently pending. We have 2 COVID patients at the JFL hospital, one of which is currently on a ventilator, and there is no COVID patient at the Snyder Regional Medical Center. I just want to talk a little second about testing, because at one point we had so little inquiries and reasons for tests that we were actually testing every other day to save on the medium, because that is a very valued commodity and it uses a certain amount no matter how much tests you take. We have stepped up our testing to about 90 a day, and ProHealth, working with the refinery, has stepped up their testing to about 80 or 90 a day as well. As we move on, you're going to see this move up to about 200 to 300 tests per day, which will certainly give us a broader variety of results, but it will assure to us too that we're making sure we're catching everybody. So positive tests are bad from a perspective that we have the virus in our community, but good because we are identifying the people who may be asymptomatic, without any symptoms, carrying the virus along and eliminating that as quickly as possible. If you are tuning into this today, then you are likely awaiting and aware that there's been a significant uptick in the positive COVID cases over the past few weeks. Not just here, but in several states. In fact, just yesterday, the United States once again broke the record for confirmed cases in a single day. This is the 4th time in the last 9 days that they have done this. We are now feeling the effects of that surge. See, while we opened up, we never anticipated that the United States would open up without masking. For the last couple of weeks, the COVID task force and I have deliberated over the best way to keep our community insulated from what was happening stateside as well as worldwide. We have considered several strategies to screen travelers from states that are experiencing a surge in active cases before they enter the territory. Like most states facing this very same dilemma, we adopted what appears to be a consensus approach. It is the approach being used by New England states like New York, New Jersey, and Connecticut, and also Rhode Island. Essentially, you will either have to self-quarantine for 14 days when you arrive in the territory or produce the proof of a negative test for COVID-19, or a positive antibody test less than 4 months showing that you have already had the virus and are now clear. But if not, you have to produce that test within the 72 hours before the arrival on the island. If a test is administered after the arrival into the Virgin Islands and you receive a negative test, the result is you can stop quarantining. But because of the surge in COVID cases, it is virtually impossible to test every single person and receive their test within 72 hours. Therefore, we are changing this policy and extending it from 72 hours to 5 days prior to your travel. So once again, it was before that you had to have a negative COVID-19 test 72 hours before you travel. We are extending that to 5 days. So beginning Wednesday, July 15, we will require that you have a negative COVID test taken within 5 days from any state with a positivity rate of greater than 10%. There are currently 10 states, I want to say that. If you're coming from any state that has a positivity rate of higher than 10%, you have to take that COVID test, get a negative result 5 days before you leave, or produce a positive antibody test proving that you had already had the virus and you're now virus-free. So there are 10 states that have this marker where they're above 10% of positivity. And those unfortunate states are Alabama, Arizona, Florida, Georgia, Idaho, Kansas, Mississippi, Nevada, South Carolina, and Texas. This travel restriction currently applies to passengers age 15 and older. We will be relying on the data compiled and aggregated by Johns Hopkins University, which is updated daily. So this is not our data we're making this distinction on. This is data that is compiled by Johns Hopkins, a reputable university and medical center, and we're going to use that. So today it's 10 states, tomorrow it might be 11, the next day it might be 12, depending on what Johns Hopkins said. But for now and the immediate future, we're rolling with these 10 states. To address the surge in the current active cases, we are also implementing a variety of measures. Effective immediately, I am ordering the closure of all bars throughout the territory. This includes bars within hotels and restaurants. Now, restaurants may continue to operate and to serve drinks, but there will be no counter service, saying that if you're in the restaurant, if you go to the restaurant, you cannot sit or stand at the bar and order drinks. You may order your drink and go back to your table or wait for an attendant to come to you. But there will be no congregating in and around bars, in restaurants, whether inside or outside. So I just want to make sure that you understand that you cannot sit or stand at the bar. In addition, all gaming centers and casinos are now closed effective immediately. When we are making these decisions, we're not making them arbitrarily. We are looking at the data and what it's telling us of the weak points of where the virus is able to spread and able to get to you and to your family. Also, the 11 o'clock prohibition, 11 o'clock every evening, all alcohol sales are to be ceased and all places must be closed by 12. From henceforth, beaches will be closed at 4 o'clock on weekends. So what we did this weekend, that will continue until further notice and we get down to below a 3% positivity rate. What we want to make sure is that we don't have mass gatherings. I am discouraging you from having mass gatherings at your homes with family members and friends. Please The virus is alive and it's in our community. Let's stop the spread. If you must, everybody wears their masks. All of the other mass gatherings we put in effect remains in effect. The maximum is still 50. We want, or it is half the occupancy rating of the fire department or 50, whichever is higher. Sorry, 50 max. So all of the parties and the large congregations, please, just eliminate it. Every morning I get up and this morning especially I got up overlooking beautiful Charlotte Amalie, and as I looked down, I smiled to myself until I remembered that we're under coronavirus. It's easy to forget that we're under a state of emergency because we have the facade that everything is okay, but we're under a serious state of emergency and the virus is moving through our community rapidly. The other weak point for us is Lime Tree Bay. Lime Tree Bay remains a going concern, and last week we made changes to the existing protocols to screen contractor and its employees coming into the facility. Lime Tree has committed to ceasing all travel for new contractors coming into the territory, and they have locked down the man camp for the next 2 weeks and have asked for contractors outside who have tested positive to self-isolate for 14 days. Yesterday we had a meeting of the meetings we meet almost every day, every other day with Lime Tree. And after much discussion, Lime Tree actually volunteered to test 100% of all its employees, and if that employee is affected, testing their family members together. So we applaud them for their citizenry as a corporate citizen of the Virgin Islands. The Department of Health, along with Lime Tree staff and ProHealth, are coordinating those activities to make sure that everyone in the refinery will be tested and contact traced appropriately. In addition to that, they have also committed to do it on an ongoing basis. So once they have tested all 3,000 of their employees, they will start the process once again. As I said, we're ramping up to about 200-300 tests per day. We have, through the courtesy of FEMA, additional tests being sent. I want to say a special thank you to Bill Vogel and Tom Van Essen for pushing and helping us get more equipment in here to do more tests, because now we're just testing as much people as possible rather than testing only the most likely to have the virus. So Lime Tree, we're going to get every single body tested so we know what our status there. These measures are somewhat what we're imposing now. May be uncomfortable, but like I always say, if you think that's uncomfortable, try a ventilator. So far, we don't have anybody in the hospital, but hospitalizations follow the initial sickness by 2 to 3 weeks. So we already have a lot of the virus out in the community, and the good news is it's been affecting people between 30 and 49 years of age. Our seniors have been safe so far, and so those people have a more resilient bodies, are able to recover quicker. So far, so good. So we hope that trend continues, but we need people to wear your mask and isolate as we make this. Now, many of you in the private sector have been patiently awaiting, who are self-employed, trying to get the pandemic or unemployment assistance and the emergency unemployment compensation. We received word this week from the Department of Labor that they've completed their system, all of the programming that's needed, and they can begin processing applications. Those individuals who are self-employed, they get a 1099, the GIG workers, independent contractors, all of those people now, churches, employees, people with nonprofits, or those who with limited work history, didn't work long enough to get your benefit allotted to you. All of those people now can apply and can get unemployment insurance cranked out again. We have also instituted the Emergency Unemployment Compensation Pandemic Program. This allots another 12 weeks of unemployment assistance to individuals should it be necessary. So this, on top of your 27, you get another 3 months. So to fill out application, you can go online at vidal.com, vidol.com, or contact their call center, 877-374-0356. As of this week, we've issued 21,665 checks on unemployment for $16.4 million and an additional $16.9 million in federal pandemic unemployment, totaling about $44 million in all that money that we have distributed to residents now over a 4-month period. I might add 5 times the average amount that we do in a year in a 4-month period. Our stimulus checks are continuing to go out. We know that people need these care funds, so we continue to crank them out. As I said, the list of Social Security recipients, we have that now, so those checks are going to start to go out to everybody. I want to thank you for your understanding and your patience. I know people are hurting out there and you need this money, but we're doing our best to get it out to you as quickly as possible. I also want to thank Joel Lee, our BIR director, and his staff, as well as Delegate Plaskett and the ARP, of course, for all of their efforts in trying to get this out. To date, we have 3,122 checks going out this week, that went out $4.7 million worth of checks, and to date we have issued some $56 million in unemployment compensation. As you know, we got $84 million, so there's about $28 million left there. A lot of that is Social Security, people who are filing late. It's still not too late. Remember, we can spend this money all the way till December. And if we don't spend it, we have to send it back. We can't keep it. So come and get that money. As a government, and as for me personally as your governor, our priority is always your health and safety. But we have other responsibilities as well. And one of those other responsibilities is making sure we stay afloat. Not just the government, but our entire community. We are not only responsible for your health and safety, but we also have to ensure your safety in a way that looks out for our first responders, in making sure they have the adequate resources, our teachers, our government employees, in making sure they get paid so they can take care of their families. We have to look out for the small businessman and woman who spend their life savings to start that business in our community. The small craft store owner, the taxi driver, the restaurant owner, the wait staff in that restaurant, our fishermen, the seamstresses, our tradespeople. These are our people. They are our friends and our family. And they too have people who depend on them for a living. The virus isn't going anywhere anytime soon. As much as we don't like it, it's here to stay for the foreseeable future. We must find a way to move forward despite the fear. And if we have to retreat, retreat when necessary, but not all the way to the beginning. We need to move to a point where we can recover, regroup, and then move forward once again. Finding the balance between the public health and the livelihood of our community is not an easy feat. It is a fine line, and COVID changes that line daily. But tread that line we must if we are to make it to the other side of this pandemic. Stay safe, stay sanitized. God bless you, and God bless the Virgin Islands. I guess I'll take some questions now. I'm joined here by Commissioner Encarnacion of the Department of Health. I'm also joined by our Chief Medical Officer of Health, Dr. Ty Hunt, to answer any questions we may have from the press. Go ahead.
Hi, good afternoon, Governor. This is Suzanne Carlson from the Daily News.
Hi, Suzanne.
Can you hear me?
Sure, I hear you fine.
Hi. My first question is, how many people are currently waiting for tests, and how long is the waiting period? And should they continue quarantining indefinitely until they hear back from the Department of Health?
In the Virgin Islands, we have 98 people scheduled for today. I'm not aware of any waiting list for any test, Commissioner.
No, we have no one on the waiting list. What we do is that there's a line list. You're actually placed on the line list, and then our epidemiology team will tell you what day to come in. And then, of course, if you are not feeling well and you're sick and in need of seeking physician's advice, please call your physician or call the emergency room and let them know that you need to come in. So do not let that stop you, but you're quite safe waiting at home until you're tested, unless your physical state shows otherwise.
One thing I want to emphasize, I'm so glad you mentioned that, Commissioner. If you just need a test, please do not show up to the hospital. Call the hotline. If you're feeling ill where you need medical attention, then certainly you need to call the hospital ahead and go there. But if you just think you have the virus, but you don't need to be hospitalized, please call the hotline. When you go to the hospital, you run the risk of infecting other patients with compromised immune system in the area. So we had this down pat when we first started. Just want to reiterate it to the public. Do not go to the hospital unless you need emergency or urgent care. Call the hotline and they'll get you tested. Go ahead, Susan, you have another question?
Yeah, so currently when people call the hotline, they're being told to wait for a response from the Department of Health, and that can take days. So how many people are waiting for that response?
Well, we could look into that, Susan, but we're not aware of anybody being waitlisted. The thing that we've been doing is, I just said in my statement that we haven't even, before we weren't even issuing enough tests to test every day. So now that we have a full load, we're getting about 98 people scheduled to be tested every single day, 80 to 90 people. But certainly we always have to make room on that list for priority people who really have been exposed and the contact tracing that we're doing. In the States, it's taken 5 days. It's taken 5 days to get back a test. In the Virgin Islands, it takes 72 hours maximum, usually 24 hours.
Right, but there's a lot of people waiting just to schedule a test
right
now.
But the other thing I want to share with the public is that you can go, most of the labs now are offering tests, so you can go to a lab and get a test. I think it's covered by Cigna Insurance as well, too, if you need to get COVID tested. Go ahead, Susan.
Are there adequate tests available in the
I didn't catch that. Repeat the question.
Are there enough tests in the territory for everyone who needs one right now?
Absolutely not, because we would like to test 100,000 people, but there are 8,000 tests available in the territory at this point. The capacity, remember, it's just not the test. You have to put it in a machine, and the machine runs. So there's a testing capacity per day at this time. We're getting more machines, but we don't have a shortage of tests.
Okay, my last question for now, and then I can reach out privately. But the threshold, the next level at which we would have to hit positive confirmed cases, what would happen then? Where is it going? If cases continue to rise, what's the next line that we might cross, and what would happen in terms of closures or other restrictions? If we don't see
it decreasing by next week from the numbers active cases now, because we're really high, we feel that what we've imposed controls it in terms of the spread, because there's not a lot of places where you're exposed to a lot of people. Bars have come up as a number one hotspot, Hovensa, of course, but if you look at what's going on in St. Thomas and St. John, with over 1,000 tourists coming in every day, we still have relatively low numbers over there. So our push right now is to control Hovensa. If we see it start to tick up on the tourist side, what we're going to do next is essentially just close down the hotel reservation system as we've done before and go back to safer at home. We're also asking employers, especially on the island of St. Croix, if you don't need your people to come in, allow them to work from home, stagger your office, wear your mask while you're in the office, and try to maintain social distance. The one positive thing, one of the positive things out of this is that our masking protocol seems to be working well. The gap is, of course, the human, whether they're going to put their mask on or not. But otherwise than not, our strategy goes beyond to go to supermarkets, bank tellers, and those kinds of people who are in contact with a lot of people to see if we have spread there. So if we don't see the numbers start to die off, then we will shut everything down again. I wouldn't hesitate to do that.
Understood. Thank you, Governor.
Thank you, Susan. Go ahead.
Good afternoon, Governor. Ernest Gilbert, next question. A few questions. This one may relate to Department of Health Commissioner. So Commissioner and the Governor, of course, as well. So I asked this question to you a few days back. We also followed up, but we haven't heard back. So we learned that the Department of Health, its contract with Pafford ended last month. And as a result, 7 to 10 nurses have left the territory, and about 20 EMTs and 2 respiratory therapists. With the cases, and of course those persons were here to help, just in case we've seen a surge of coronavirus cases. If you may, respond to that as to what we're going to do. Are we seeking to renew a contract, or is the number of folks we have here, EMTs and medical personnel, is that adequate to deal with the surge we're seeing right now?
Good afternoon, Ernest, and thanks for that question. The nurses as well as the respiratory therapists that were placed at the hospital, that actually came, that funding source came from a grant. And so that we were only able to provide assistance to the hospital for 1 month. And actually it was 3 months. And the 3 months ended, I think, June 4th, and that's why those workers had to go back. If we had more funding from that grant, of course, we would have provided more time to support the efforts at the hospitals, because we completed that work on both hospitals. In terms of a contract, we've entered into a contract with Pafford since last year. They provided work for us from January until June. That was in lieu of an emergency. That was a tremendous amount of finances that was placed into that. Actually, to be honest with you, it was about $6.9 million or $6.3 million. And we have put forward for funding for that to support that effort. We also have continued working with Pafford. It's just on a lower scale. So we have EMTs or paramedics, actually, both on St. Croix, St. Thomas, and St. John currently. Of course, we've reduced significantly so that we'll be able to, the governor just spoke about our finances in order for us to continue and provide service not just to first responders are critical, so we continue to support that, but we have to make sure that we have funding for other areas as well. So that's really what it is. So the contract hasn't finished. It was just reduced.
Okay, so to follow up on that quickly, if the surge that we're seeing continues, do you think the medical personnel we have now in the territory, are they able to handle that surge to make sure that patients are well taken care of?
No, actually, that's one of the concerns that we have. Both hospitals have the same concerns. And because of that, we do have the capability of going back into a higher level of contractual agreement with Pafford if needed. But we're also reaching out to Imana, which is a volunteer company that came about maybe 3 weeks ago, and we're working with them to come back, and they will be providing a different level of support internally, both inpatient area. We're working on a MOA with them. There's no monies exchange. It's volunteer, like I said, but we're working on an MOA so we can have identified scope of work that we both agree upon and that we can put them to work as soon as possible.
So you believe, last follow-up on this question, and so you believe the funding would be available when that time comes about?
I am so sorry, I didn't hear it. Could you repeat, please, Ernest?
And so do you believe the funding will be available once that time comes around where you need to get more individuals, medical personnel, help for the territory?
We will see, if we get to that point, we will seek funding through support from the federal grants and through the governor's office. work with OMB. We'll do whatever we need to do to ensure that we have the clinical support at point that we need it.
We will have the funding, like I said all the time, when we initially got the CARES Act funding and other funding, we don't know when this was going to end. And I've been criticized because we're not spending the money fast enough or whatever. But when you don't know when you're going to get to the end of the desert, you always save your water. And so we've been really conservative about what we spend money on, and so we can be able to last through this eternal storm, which looks like it's going to go well into next year. So we're prepared to staff up and get the resources that we need, and the funds will be available.
Okay, thank you, Gautam. A few questions for you here. You mentioned, of course, the shutting down of bars, restaurants will remain open, although bars within restaurants will close. Hello?
Yeah, I don't want people to get confused. Bars, restaurants are still open, but you just can't go to the bar in the restaurant.
Yes, I was saying that, Gav. But what I wanted to say was, no clarity on church gatherings. I know you are allowed for 50 persons to congregate within churches. Any new guidance for churches?
No, we've been running good with churches. We haven't had, knock on wood, any incident thus far, and those guidance remain the same. Did we get that? Did we get the final listing from the church? We met with the churches, and they were supposed to send us a list of suggestions, but those suggestions certainly would only be considered if we were paring down. But now that we're on the uptick, we really are hesitant to approve anything lifting restrictions at this time.
All right. I know you mentioned 2 individuals at the Wanganui Hospital. Nonetheless, you said most of the COVID-19 cases we are seeing thus far in the recent surge between ages 30 and 49. Can you give the age range of the persons who are hospitalized at the hospital?
No, we can't give out that. I was watching the news today, and they wouldn't even give out like the district that the person was from because of HIPAA, the HIPAA laws. You know, we're not going to be giving out information like that because it's too small a community right now. And on that note, I want to say something too. I want to really emphasize we had a real scare yesterday with people identifying people who took the antibody test and got positive. The antibody test means at some point you were exposed to the virus and your body has built up now antibodies immunity towards the virus. So it doesn't mean that they're shedding or they've had the virus in the past. So I just want to clarify that so that people could be a little bit more at ease. But, you know, just stay away from people and you'll be good.
Governor, may I?
Sure.
One of the things that we've been experiencing in the EPI hotline is a tremendous amount of calls because everyone is now questioning the process for coming to the island, tourist questions. And so we worked with the Division of Tourism, Department of Tourism, and came up with the Department of Tourism Information Hotline. And their hotline number is 1-800-372-8784. 1-800-372-8784. And that is the number you call with questions regarding travel. If by chance you are feeling concerned about COVID-19, you don't have to have symptoms because we've opened up the level of testing that we're doing. Please call either of these numbers, 340-712-6299, 340-712-6299, or 340-776-1519, 340-776-1519.
Thank you, Commissioner.
Okay, Governor, 2 more questions. If you can answer, what is the health of the government in terms of finances, an update on that $60 million RAN? If you give the community an update on that, and final question.
We intend to close on the RAN at the end of August. You know, the condition and the health of the government is the same. It has not improved. We're holding steady. We're going to be able to make our payroll and be able to get through July. So that's good news.
Okay. Gov, one last question, Coach, and it's off topic there. What's your stance on the Department of Public Works digging up a racetrack up in Williamsville like that young individuals have put together looking for recreational activity, especially during this COVID-19? It was dug up today. A lot of anger, frustration in the community, a lot of people going live talking about it. What's your stance on that?
So you're asking me why we dug up an illegal racetrack, which was on a property illegally, that the person asked to have it removed, that people, especially young people, were amassing with, running animals who are not trained properly, without guidelines, that could trample people or kill them in the way. That's what you want to know, why we stopped the illegal activity? That's your question?
I was asking for your stance on it, Governor.
I mean, it's not directed to you. It's not directed to you, Ernest, and I don't want you to take it personally. But in the Virgin Islands, we like to pretend a lot. And, looking the other way while people conduct illegal horse racing and mass gather at a site where you're putting a lot of people in danger is one thing. But looking away when it's on Facebook and everywhere on social media, showing the dangerous situation there, looking away when the owner is giving us permission and telling us, please remove these people from my property. We can't just use the laws when they're convenient. We have to use the laws to enforce order in this territory. We got this way of not enforcing the law when we like the person or we like what's going on. The law is the law. It's an illegal gathering, number one, under the state of emergency. But most importantly, we are putting the lives of Virgin Islanders at risk. One of those horses get away and trample your child. They're going to be the first person to say, oh, the government no, and the governor no. Every time I fly to St. Croix and I see that racetrack, I cringe because it is such a dangerous situation. The only horse racing that's supposed to be going on is the one sanctioned by the Racing Commission. I don't know how anyone could get on and endorse this activity, especially in this time when we know what we're going through. All we're trying to do is keep people safe. So if that includes breaking up and tearing down illegal horse racing activity, then so be it. We have to start enforcing all the laws of the community and doing the right thing, not when it's just convenient, but when all the time, because it's right. Thank you.
Thanks.
One more question.
Hi, good afternoon, Governor. This is Ali Bornfinek, USVI News, CBS.
Hi, Ali.
Hi. My question is, and this may have already been asked, but just in case, given the changing numbers, and this is going back to incoming travelers into the territory, given the changing numbers every day that we're seeing surging across the nation, did the administration consider requiring all incoming travelers to require negative COVID-19 tests? And if so, what were the reasons for deciding to go with just the states that it appears to be surging?
So what we did is when we make a decisions, the first thing we do is gather information to see what other people are doing. And we thought this 10% positivity rate is a good barometer. We have a lot of partners in the industry, the airline people, the cruise people, the taxi drivers, and people ask us, after we make these decisions, why? So we wanted to pick a good benchmark, and we thought that Johns Hopkins having that 10% positivity rate is a good benchmark, and that's why those 10 states were identified. So there's a little bit of rhyme to the reason, and yes, I wanted to ban everybody without a test, but we compromised, and we said we're going to do the Johns Hopkins meter. Because if we did everybody, then how would we start to back off of that? What meter would we use in order to back off from every single body having to test? So I hope that answers your question.
It does. Thank you, Governor.
Thank you, Ali. That's it for questions. I just want you to be safe. I don't sleep at night thinking about all these things and how we could just, what we could do to make you safer and still walk that fine line and that balance. Because if we knew that it was going to be done next week, shut it down. If we knew it would be done in 4 weeks, we would shut down the entire thing. But we don't know when it's going to be done. So we can't all hide in the foxhole. We got to figure out a way to drive through this. And when we discuss things like the opening of schools and who we're going to let in here, all of these things depend not only on what we do in the Virgin Islands, but the responsibility that's being taken on by these United States and the leadership therein. And so far, it has been a little bit irresponsible. As a matter of fact, a lot irresponsible. To open your doors without having a masking policy and allow people to interact all the time. If you're going to talk to somebody who doesn't live in your house face to face, keep on your mask. They may love you to death. They don't want to give you the coronavirus, but they're going to give it to you. So please, please wear your mask. Put it on when you leave your house. Take it back off when you get back. That should be the barometer as much as possible, just to stay safe. Thank you and God bless you. Have a good weekend. Remember, the Spanish version of this will be right after. It probably won't be as intensive as this one, but you'll get the basic information. Have a good day.
Buenos días. Ayer realizamos 157 pruebas, 22 de estas dieron positivo. Esto equivale a un 14% de positivos. 13 de esos casos se encuentran en Santa Cruz, 5 de los cuales estaban relacionados con las facilidades de Lime Tree Bay. 7 de esos casos estaban en la isla de San Tomás. Los otros 2 casos positivos identificados fueron en St. John. Actualmente estamos rastreando 57 casos activos de COVID en el territorio. No está por demás decir que aquí no es donde queremos estar en este momento. Pero esto es un claro recordatorio del por qué debemos permanecer vigilantes. A partir de esta mañana, hemos probado 3.610 individuos para el coronavirus. 3.370 de esas pruebas dieron negativo. 144 fueron positivas y tenemos 96 pruebas pendientes. Tenemos 2 pacientes positivos de COVID en el Hospital Juan Francisco Luis, uno de los cuales se encuentra ventilado. No hay pacientes de COVID positivos en el Centro Médico Regional de Snyder. Si usted está sintonizando a esta rueda de prensa, entonces es probable que sea consciente del brote significativo en casos positivos de COVID en varios estados en las últimas semanas. De hecho, ayer, los Estados Unidos rompió en un solo día, una vez más, su récord de casos confirmados. Esta es la 4ª vez en los últimos 9 días. Es ahora cuando estamos sintiendo los efectos de este nuevo brote. Durante las últimas 2 semanas, el grupo de trabajo de COVID y yo hemos deliberado sobre la mejor manera de mantener a nuestra comunidad aislada de lo que estaba sucediendo en los Estados Unidos. Hemos considerado varias estrategias para examinar a los viajeros de estos estados donde existe un brote en casos positivos antes de su entrada al territorio. De igual manera que la mayoría de los estados se enfrentan a este mismo dilema, hemos adoptado lo que parece ser un consenso. Este consenso está siendo utilizado por los estados de Nueva Inglaterra, como lo son Nueva York, Nueva Jersey, Connecticut y Rhode Island. Esencialmente, tendrás que autoaislarte durante 14 días cuando llegues al territorio o presentar el resultado de una prueba negativa para COVID-19 tomada dentro de 72 horas antes de tu llegada a la isla. Si se administra una prueba después de la llegada a las Islas Vírgenes y recibes un resultado negativo, entonces puedes ponerle fin al aislamiento o a la cuarentena. Debido al aumento de los casos COVID, es prácticamente imposible recibir los resultados de las pruebas en un plazo de 72 horas. Por lo tanto, estamos ampliando este periodo a 5 días antes de tu viaje. A partir del miércoles 15 de julio, requerimos una prueba COVID negativa tomada dentro de los 5 días de viaje desde cualquier estado con una tasa de positivos superior al 10%. Actualmente hay 10 estados que desafortunadamente cumplen con los criterios: Alabama, Arizona, Florida, Georgia, Idaho, Kansas, Mississippi, Nevada, Carolina del Sur y Texas. Estas restricciones de viaje se aplican actualmente a los pasajeros de 15 años o más. Confiaremos en los datos recopilados y agregados que se actualiza diariamente por la Universidad Johns Hopkins. Para abordar actualmente el brote de los casos positivos, también estamos implementando las siguientes medidas. Inmediatamente, estoy ordenando el cierre de todas las barras en todo el territorio. Esto incluye barras dentro de hoteles y restaurantes. Los restaurantes pueden seguir sirviendo bebidas alcohólicas, pero no habrá servicio desde los mostradores. Por lo tanto, si hay un bar dentro de un restaurante, los clientes no pueden sentarse ni pararse alrededor de la barra. El objetivo aquí es evitar la congregación de los mostradores en los mostradores de las barras. Sigue vigente la prohibición de ventas alcohólicas después de las 11 de la noche. Las playas permanecerán cerradas a las 4 de la tarde los fines de semana y días feriados hasta nuevo aviso. Siguen vigentes las restricciones a las concentraciones de grupos en masa. Eso significa que no habrá eventos o fiestas que animen a las grandes congregaciones de personas. Lime Tree Bay sigue siendo una preocupación. La semana pasada también realizamos cambios en los existentes protocolos para examinar a los contratistas y empleados de la instalación. Lime Tree se ha comprometido a suspender los viajes para nuevos contratistas. Han cerrado el campamento durante las próximas 2 semanas y han pedido a los contratistas que viven fuera del campamento a que se mantengan en cuarentena por los próximos 14 días. Lime Tree Bay voluntariamente se ofreció a llevar a cabo pruebas en el futuro del 100% de sus empleados cada 2 semanas. Muchos de ustedes han estado esperando pacientemente noticias sobre el progreso de los beneficios en el marco de la asistencia de desempleo pandémico y los programas de compensación por desempleo de emergencia pandémica. Recibimos las noticias esta semana que el Departamento del Trabajo ha completado la programación en el programa de asistencia al desempleo pandémico y puede comenzar a procesar las solicitudes para personas que trabajan por sí solas, contratistas independientes 1099, taxistas, empleados de iglesias y empleados de personas sin fines de lucro o aquellos con historial laboral limitado que no califican para nuestro programa regular de beneficios por desempleo. También hemos implementado el programa de compensación por desempleo de emergencia pandémica que permite 12 semanas adicionales de asistencia por desempleo a personas en caso de ser necesario. Para presentar una solicitud en línea, visite el sitio de red en www.vidol.com o comuníquese con su centro de llamadas al 1-877-374-0356. A partir de esta semana, el Departamento del Trabajo de las Islas Vírgenes ha emitido 21.665 cheques por desempleo por un total de $16.4 millones y 16.946 cheques federales por desempleo por pandemia por un total de $27.6 millones. Eso es un total de $44 millones a los residentes de las Islas Vírgenes que han perdido empleo como un resultado de la pandemia. Continuamos nuestros esfuerzos para obtener los fondos necesarios de la ley CARES para nuestros residentes. Finalmente, hemos recibido la lista de beneficiarios del Seguro Social del Departamento del Tesoro de los Estados Unidos. Esto fue realmente un esfuerzo en equipo, pero primero quiero agradecer a nuestros beneficiarios de Seguro Social por su paciencia y comprensión. También quiero dar las gracias al director de Rentas Internas, Joel Lee, y a su personal, así como a la delegada Stacy Plaskett y a AARP por sus esfuerzos. Nuestro mayor número de pagos de estímulo a la comunidad incluyó 3.122 cheques por un total de 4.7 millones. Hasta la fecha, hemos emitido 34.883 cheques por un total de $56.3 millones. Como gobierno y para mí personalmente como gobernador, nuestra prioridad es siempre su salud y seguridad. Pero también tenemos otras responsabilidades. Una de esas otras responsabilidades es asegurarnos de que nos mantengamos a flote. No solo somos responsables de su salud y seguridad, sino que también tenemos que garantizar su seguridad de una manera que se ocupe de nuestros socorristas, en asegurarse de que tienen los recursos adecuados, nuestros maestros y empleados del gobierno, en asegurarse de que se les pague para que puedan cuidar de sus familias. Tenemos que cuidar de este dueño de pequeña empresa que gastó sus ahorros de toda una vida para iniciar ese negocio en nuestra comunidad. Tenemos que cuidar del propietario de la pequeña tienda de artesanía, el taxista, el propietario del restaurante, el personal de camareros en ese restaurante, el pescador, la costurera, nuestros comerciantes. Esta es nuestra gente, son nuestros amigos y nuestra familia. Y ellos también tienen personas que dependen de ellos. Encontrar el equilibrio perfecto entre la salud pública y el sustento de nuestra comunidad no es una hazaña fácil. Es una línea fina y el COVID la cambia a diario, pero debemos caminar sobre esa línea si queremos llegar al otro lado de esta pandemia. Es por eso que necesitamos que sigas tomando en serio las guías de salud, que uses tu mascarilla, que te laves las manos y practiques el distanciamiento social. Esta noche no habrá Press Box, pero el próximo jueves tendremos al Departamento de Salud y al Departamento de Educación para discutir con ustedes la reapertura de las escuelas. Antes de irme, de manera especial, quiero darle las gracias a Stephanie y a Jasmine, nuestras intérpretes de señas ASL, que han estado con nosotros desde el comienzo de esta pandemia. Las extrañaremos. Que Dios les bendiga y que Dios bendiga a las Islas Vírgenes.